Randomized control trials. I know you're thinking, what is a randomized control trial? Well, that's why I'm here, to tell you all about it. A randomized control trial is able to minimize bias as it randomly allocates participants to receive different clinical interventions and research projects. So, clinical interventions, what are they? Well, typically in a standard randomized control trial, the research will be testing the efficacy of one intervention against another. This is commonly a drug versus a placebo trial. Whilst a randomized control trial is simply that, random, there does need to be a way to control the initial groups to ensure that there are as many similarities as possible across the groups. If the trial was to, say, test the efficacy of blood pressure medication on participants, there would need to be similar characteristics of groups prior to the test beginning. If one group, say, already had lower blood pressure on average than the other participant group, the results would be biased, lowering the internal validity of the test. How does a randomized control trial work? Well, in the case of the blood pressure medication trial, the groups would be separated. One group would be given the drug which is being tested, and the other group would be given a placebo. The researchers would then monitor and record the ongoing results to determine the efficacy of the drug against the results of the placebo. With any research, there's always positives and negatives. Some positives of the randomized control trials include that it's a gold standard of research, there's high internal validity, researchers can control timing, frequency, amount, and duration. It is a true measure of efficacy, and it's able to be conducted double-blind. Some negatives include that there's low external validity. It's undertaken in artificial environments, so usually medical centres, research facilities and hospitals, and this means it usually can take quite a lot of time and can be quite expensive. And randomised control trials are typically only used for therapeutic or preventative research. After the research has been conducted, the results are typically written and published in a journal for all to see. A way that you can determine if the results would be able to be considered accurate or reliable is to determine if there was a concert, meaning Consolidated Standards of Reporting Trials, statement referenced. Without this statement, the research may have been inaccurately undertaken or the report may have been poorly written.